During this module, we will cover a very important part of pharmacology and toxicology. This is the ability to calculate dosages of drugs and solutions. The study of the dosages of medicines and drugs is also known as posology. We believe that this material will help you develop a good level of competency. As we all know, there are many different ways to perform calculations and to get the correct answer. You will need to identify the best way for you. The more use you make of the detailed handout and practice questions, the fewer problems you will have when you begin making those calculations. Following a step-by-step approach and using basic mathematical skills, you will be able to consistently perform calculations accurately and confidently. During this module, we will cover a very important part of pharmacology and toxicology. This is the ability to calculate dosages of drugs and solutions. The study of the dosages of medicines and drugs is also known as posology. We believe that this material will help you develop a good level of competency. As we all know, there are many different ways to perform calculations and to get the correct answer. You will need to identify the way that is best for you. The more use you make of the detailed handout and practice questions, the fewer problems you will have when you begin making those calculations. Following a step-by-step approach and using basic mathematical skills, you will be able to consistently perform calculations accurately and confidently. The ability to accurately manipulate numbers is fundamental to the practice of pharmacology, toxicology, chemistry, physiology, and many other research disciplines. Scientists in the fields of medicine, nursing, forensics, chemistry, and toxicology constantly perform calculations. If you approach drug calculations in a logical manner, many errors can be avoided. Often, drug dosages can be calculated in your head, or at least you can obtain a rough estimate of the correct amount. Of course, you should always double-check your thinking mathematically. When calculating dosages, always consider the reasonableness of the computation. If you have a feeling that something is not right, it most likely is not. Let common sense prevail. If you use an app to assist you, make sure that the result meets the reasonableness of the computation. In poisoning, it is important to interpret the significance of numbers resulting from laboratory analyses and to determine the dose of a toxicant a human or an animal has potentially consumed. It is important to understand the importance of calculations in medical sciences. Serious harm to a patient can result from small mathematical errors when calculating drug dosages. Therefore, the ability to accurately calculate dosages is of utmost importance. This is not an option. This is supported by statistics from 2013, where it was reported that calculation errors accounted for 9.8% of ICU medication errors. The take-home message here is that serious consequences can result from calculation errors and that it is best practice to at least have one other person check your calculations. The learning objectives for this module are: describe common abbreviations and terms used when performing pharmacological and/or toxicological calculations. Demonstrate knowledge of common conversion factors. Perform mathematical calculation using the concept of ratio and proportion. Explain the relationship between common fractions, ratios, and percent, and express equivalents of each other. Convert numbers from one unit of measure to another unit. Examples would be to convert from molarity to milligrams per liter, or grams per pound, or grams per kilogram. Demonstrate proficiency in calculations to dispense medications, such as tablets or liquids. Solve exposure calculations. In order to meet the learning objectives of this module, it is necessary to read the handout Calculations Overview and to complete practice questions that are provided to you through the Learning Management System. As I mentioned, it is very important for you to review the complete handout. Make sure to spend time on the practice quiz questions. In addition, there are many practice calculation tools online. I listed a few here to check out. Here are a few commonly used terms that I would like to introduce at this time: strength, dose, and dosage. Strength refers to the concentration of the active ingredient. Dose is the amount of a drug or toxicant given at one time. Dosage implies duration. Thus, dosage is the quantity of drug per unit of time. This term is then used to determine the dosage regimen, i.e., dosage has information on the strength, the frequency, and the form of doses. Let's look at an example of ibuprofen. The recommended dose for an adult is 400 mg. If the body weight is known, the dose can be expressed on a milligram per kilogram body weight basis. If the person weighs 70 kg, the dose would be 5.7 mg per kilogram body weight. The suggested dosage is 1200 mg daily. The form of the medication is a tablet. The strength is 200 mg, and the frequency of administration is 3 times per day, with 400 mg given with each dose. Let's look at an example of an important calculation. We want to determine how many tablets must be dispensed to a child weighing 20 pounds with a required dose of 5 mg per kilogram body weight. The medication comes in 10 mg tablets that can be safely broken in half. The tablets must be given twice per day for 10 days. First, we need to convert pounds to kilograms by dividing by 2.2. Thus, the child weighs 9.1 kilogram. Next, we need to determine the total amount of drug per dose by multiplying 5 mg by 9.1 kilogram, which results in 45 mg. Because each tablet contains 10 mg of active ingredient, the patient will require 4.5 tablets per dose. Considering the frequency of 2 doses per day for 10 days, a total of 90 tablets must be dispensed. Here is another example that requires a number of conversions and calculations. The goal of this so-called exposure assessment is to be able to evaluate whether an animal, in this case a dog, ingested a toxic or potentially lethal dose, given the information about the animal and the bait. Keep in mind that in many instances, those details are not available and those calculations may not be performed. Let's get started with the information provided. We have a 75-pound dog who consumed 4 ounces of bait, and the concentration of the toxicant in the bait is reported at 0.005%. We also know that the oral lethal dose of the toxicant in a dog is reported to be 0.2 mg per kg. The dog weighs 75 pounds or 34 kg. The dog ingested 4 ounces of bait, which is equal to 113.4 grams. The bait contains 0.005% of the toxicant. It is now critical to be able to determine the amount of the toxicant in the 113.4 grams of bait consumed. For this type of calculation, a solid understanding of calculations with percent is necessary. Make sure to familiarize yourself with percent calculations. In this case, 113.4 gram of bait contain 5.67 milligram of toxicant. The last step in this assessment is the exposure expressed in milligram toxicant per kilogram body weight. The dog weighs 34 kilograms. Thus, the exposure is 0.167 milligram per kilogram body weight. This result is close to the reported oral lethal dose of 0.2 mg per kg. Thus, the exposure must be treated as a medical emergency. We conclude with a few questions that test your understanding of the material presented in this video and in the handout Calculations Overview. You should be able to assess whether you have reached competence in medical calculations and identify areas you have to spend additional time on. Questions focus on percent, kilogram and pound conversions, tablet calculations, milliequivalent conversions, a definition of QS, understanding of liquid volumes in common use language, such as teaspoons or ounces, and commonly used abbreviations in medical pharmacology.